It's now my great pleasure to introduce the Minister for Mental Health, the Minister for Healthy Lifestyles and the Minister for Western New South Wales, the Honourable Kevin Humphries. Kevin's a man from Moree who represents about 30% of the population of New South Wales, and mental health, which is critically important for the 13-14 year as we move into new funding arrangements, is his key portfolio responsibility. Thanks.
As Rohan said, I'm the Minister for Western New South Wales as well, which is 30% of the geography, not the population. Barry's probably got that as not only the whole state but also as the Minister for Western Sydney. Just wanted to recap for 30 seconds just on a little bit about my background and where I'm coming from. I don't have, as the Minister for Mental Health, I don't have a resident psychiatrist in my electorate, which is 30% of the state. And if you took Broken Hill out of the far west, it would be for 65% of the state. So whilst it's rural remote, and we recognise it's not a large population base, it is a very large area. I have no staff specialists in my electorate. My nearest staff specialist would be in the Hunter New England LHD in Tamworth, or if you're in Cobar, it would be in Dubbo. So a lot of the conversation in the first session about networks, cutting across barriers, but more importantly, working in a collaborative framework, whether you're in management, whether you're in the bureaucracy, or whether you're a clinician who provides in-reach and or outreach services, a large proportion of the state is very much dependent on what was discussed here this morning, because we can do better and we must do better, and certainly about improving patient care. And some of you would have heard me speak about this at other functions. It doesn't matter where you live in New South Wales. Everybody has the right to accessible and quality care. And I don't get hung up on the remote thing. I was at St George Hospital yesterday and I was talking to an older lady afterwards who came to the function who, without her carer, who lived 200 metres from that hospital, if she didn't have access to that care through her extended family, would be just as remote and isolated as someone that I have living 200 kilometres west of Burke in terms of isolation. Isolation means different things to different people. But as the Minister for Mental Health and the first Minister for Mental Health in this state, I see it as a privilege, and certainly we're about more accessible and accountable care, and to have a system where the patient's needs come before that of the system that's designed to serve them. Let me tell you why this is important. Imagine the moment you or someone living with a mental illness and you have your first mental health crisis or episode. You might see a GP. The GP might then refer you to a psychiatrist, if you can find one. The psychiatrist could then refer you to a range of support services. At every step of this process, there are phone calls, appointments, transport arrangements, and it can seem that every time you reach the summit of one mountain, there is another time and another one you have to climb that's in front of you. If we're serious about delivering services that are focused on the patient and that are focused on delivering better outcomes for the patient, then we need to rethink the way that we deliver mental health services, not just in New South Wales, but across the country. This is the reason why we are working with local health districts to deliver a new model of individually focused, community-based adult mental health care. And I would like to see consortiums of healthcare providers, be they public, non-government or private, working together to deliver the best kind of care for mental health patients. Sometimes this means clinical mental health care, but sometimes it means primary care, drug or alcohol treatment, or social and vocational support. I'd like to see a system where a patient only has to walk through one front door and encounters a system designed to navigate their needs, rather than the patient or their loved ones being left to try to navigate the system on their own. We want to build on the success of the federal Headspace program, and you might want to reflect on that later today, because I'm very keen to go into that adult space as well. Maybe it might be called My Space or Our Space, and that's something we're talking to some of the LHDs about currently. Why does this need to happen? We're currently seeing a big change in our population and the expectations they have of the health system. There's rapid growth in health issues that come with ageing, a growth in the number of people with chronic problems, a sense throughout the community that we can tackle and match any health problem, an overwhelming demand for health services, plus shifts in where people live and how they live. Everyone is looking for personalised service and treatment, and they're used to it now. Technology has designed their relationships into one-to-one exchanges, usually from the comfort of their lounges. Health is exactly the same. People want close to home, tailored treatment and a system that looks at the whole patient and not just their mental health problems. We know that if a mental health consumer has stable housing, a job and social networks, then they're on the right track. We need to design a system that doesn't put up barriers, but a system that strives to ensure our consumers are given the best possible path to recovery. We also know that people with a serious mental illness die on average 25 years earlier than a person in the general population. We know that 70% of people with a serious mental illness die from cardiovascular disease compared to 18% of the general population, and that around 60% of people with a serious mental illness smoke compared to 17% of the general population. That's why I'm holding a summit in the next 2 weeks with all the state mental health ministers and our federal colleagues here in Sydney. If we are to truly address the needs of people with a mental health problem, then we need to treat the whole person, because the most important indicator of all is closing the gap in life expectancy. We know our hospitals are superb and are stabilising a highly regarded basis for care in New South Wales. And we know implementing a community-based network will be more difficult to implement, but a much better understood concept in places including rural and regional New South Wales. I'm looking forward to working with our newly formed Mental Health Commission and realising the reforms that focus on improving mental health care across the whole of life continuum. And ladies and gentlemen, thank you for the opportunity to be here with you this morning. I hope you enjoy the remainder of the Shared Experience Symposium. Thank you.